Here's some breaking news. Health insurance premiums are set to jump in 2026.
2026 is shaping up to be the most expensive year for employer-sponsored health coverage in over 15 years.
If you're one of the millions of Americans who gets their health insurance through their employer, be prepared because in 2026, rates are going up and the cost may hit you in a different way than you expect.
A lot of Americans are going to lose their health care next year and they don't even know it.
We're going to lose a bunch of people that pay for it on their own, like myself. So there's going to be a shit ton of people without insurance.
This is a really big deal because this means that there are going to be about 160,000 people left without a Medicare health plan and prescription drug coverage.
How there was going to be an increase, and the numbers that she was throwing around was like anywhere from 20 to 27% increase on the rates for your insurance, which means your checks are going to be smaller. Be prepared, guys. Be prepared that everything is going to get tight.
Welcome to Real Talk, a channel dedicated to capturing the raw, unfiltered perspectives from everyday people. No commentary, no interruptions, just real people sharing their frustrations and opinion about the economy. My goal is simple: provide a space where you can hear authentic rants, opinions, and stories from all walks of life. So make sure to like and subscribe and enjoy the rest of the video.
Here's some breaking news. Health insurance premiums are set to jump in 2026. The latest data shows insurers are requesting an average of 15% increases, the biggest since 2018. In some states, plans could jump more than 30 or even 60%. Why? It starts with Congress. They let COVID-19 era subsidies expire this December. That means millions of people could see their monthly costs double or worse. On top of that, hospitals and drug companies are charging more. Insurers say GLP-1 medications, staffing costs, and new enrollment rules are driving up prices. In New York, one carrier asked for a 66% increase. In Texas and Rhode Island, over 25%. The middle class may be hit the hardest, especially if Congress doesn't bring back subsidies. The White House says new verification rules could save some money, but for most people, that won't be enough. Expect final rates this fall and a lot of sticker shock. My name is Jared Zisser. Follow me on Instagram, TikTok, and Substack for all breaking news, all updates, and the full story.
Attention Medicare Advantage members. Big changes coming for 2026. Some major insurers like Aetna are scaling back on their Medicare Advantage plans, especially the PPOs. This means fewer options for hundreds of thousands of you out there. I am a registered nurse providing advocacy tips for the ridiculous U.S. healthcare system, as well as home health content for clinicians. Follow me if you wish. So I've been seeing a lot of concerning changes. We all know it's happening just wide, even for a lot of the insurance plans going up in price. Here's the claim by the Centers for Medicare and Medicaid Services that overall access to plans should stay stable and most of you will still have choices, but here's what you need to know. Insurers are pulling back. Some plans, including those supplementary benefits like you like or your loved one likes, like the grocery store cards, might be going away. Watch for higher cost. Some of the private plans could come with higher premiums, so keep an eye out on your options. Make sure you, or if you are assisting your loved one, review your annual notice of change. This is your chance to compare the plans during annual enrollment period. Do this. Make sure you are getting the best plan or your family member. Stay informed and make sure that the coverage is best for you. There are so many ways that patients will continue with the same plan and not even understand what benefits they're losing and what costs are going up. So make sure you are comparing during the open enrollment time.
Okay, if you have healthcare insurance right now and there's something you need done or you need dental work done, I would probably do it, or at least what's covered. I would probably get it done this year. Looks like, so a lot of people don't understand something that's going on right now is that when Obama created Obamacare, it's basically a lot of it is funded through the government, aka debt, aka printing money. So the subsidies are running out at the end of 2025, meaning the government was helping subsidize this awesome healthcare, which is obviously not how anything technically should work. But anyways, that's what's going on. So they're predicting that if the healthcare subsidies don't get extended past 2025, which they might not, we could be looking at around 75% increases, or even more, maybe 100% increase for healthcare going into 2026. And what Obamacare did is it basically mandated coverage for pretty much everybody. It doesn't matter if you are morbidly obese, no matter how much you don't take care of yourself, if you had condition, and if you did have conditions that you couldn't control, it covered you. But unfortunately, insurance companies cannot control who they cover, so we have a record amount of people right now canceling insurance, and I think going into 2026 we're going to see people cancel like crazy. And then what's going to happen is that's going to create a downward spiral. It's going to create upward pressure on the premiums for anybody else that has them, because now there's less money coming into the system, especially from more healthy people. So rates might even just kind of go parabolic. So in case you have to cancel your insurance, you may need to go ahead and get stuff done this year, while you can, because I have a feeling a lot of people are going to have to cancel their premiums starting next year. If you haven't looked into it, check it out.
2026 is shaping up to be the most expensive year for employer-sponsored health coverage in over 15 years. According to Mercer's National Survey of Employer-Sponsored Health Plans, the average health benefit cost per employee is expected to jump 6.5%, and that's after cost-cutting measures. Without those measures, the increase would have been closer to 9%. So this marks the fourth year in a row of elevated cost growth, compared to a decade of increases averaging just 3%. So what's driving this? Two things: higher prices and higher utilization. So on the price side, advances like new cancer therapies and weight loss drugs improve outcomes, but they're expensive. Consolidation of health systems means fewer players with more bargaining power, and inflation, including higher healthcare wages, is adding pressure. So even AI billing tools are being flagged as potential cost drivers. On the utilization side, patients are catching up on care delayed during the pandemic. More staff capacity has opened, and virtual healthcare has lowered access barriers, especially in behavioral health. So employers are responding. Nearly 60% plan to make changes in 2026, most often by raising deductibles and cost sharing. So that means employees may see higher out-of-pocket costs at the point of care. So the bottom line, while innovation and access expand, working Americans are likely to feel the pinch in their paychecks and at the doctor's office.
A lot of Americans are going to lose their health care next year and they don't even know it. Please check on your family members. Please tell people to get ready to start asking questions, to understand their insurance, their plan, to start their plan, and start saving. Because what the big, beautiful bill that's about to get real ugly, all type of things are going to happen next year to a lot of Americans. And, this is what happens when you don't believe what someone has already shown you, right? The president, 47, has already shown us when he was 45 that he's willing to let people be unalived. And I'm very careful of what you say because this app is censoring people for all type of stuff, right? But when the C word happened in 2020, we saw how many people, Americans in the thousands, that, we saw what happened. So just start looking out for your people, start saving up, start letting those that you know that already are struggling to pay their health care to to get ready and time to come together with our communities and really lock in to help those around us. Peace and blessings.
Well, I just got some disturbing news a couple weeks ago. Aetna, one of my favorite health insurance companies, well, they're leaving the market come 2026. Well, that's only for the individual family plans underneath the ACA. They're still going to be around for Medicare, but they're leaving the ACA market, the healthcare market, healthcare.gov market. They're leaving that. And that's very sad. I got hundreds of customers that are actually enjoying the Aetna plans, and we're not going to be able to use them anymore. But there's still a whole bunch of other carriers out there. I mean, there's Blue Cross, United, Oscar, Cigna. I mean, a whole bunch of different ones that we still have to pick from. It's just, one of the great ones, they're just leaving. So come September, in fact, September 11th is my first kickoff, the first meeting I'm going to be going to. So September and October, very busy times. I get to meet up with all the carriers, go through all the details of what 2026 is bringing, how the plans are looking, what the sneak peeks of the pricing is going to be. So, I got all the information coming, so stay tuned. I'll still help you out, anyone in Texas. I'm Tim the Broker. That's what I do. I help Texans out get affordable health care insurance that actually meets what your needs are. So stay tuned. I'll have some more information coming your way.
This health insurance increase for 2026 enrollment is going to hurt our feelings. I know it is. I can feel it. And I've been thinking about it. It's September. I think we see ours soon. I'm not ready to see what it's going to look like. I'm not. I ain't gonna lie. But I know it's 2026 is going to hit us hard. It's going to hit everybody hard. So, y'all been thinking about it? I'm just wondering because I'm one of them people that try to budget yearly, okay? I try to see what I'm going to pay off and what is going to increase or whatever. I'm big on that. But y'all, for real, 2026 health insurance enrollment plan is going to look, it's not going to be like that normal increase that we normally get, that little bit of increase. No, I'm not. Anyway, y'all tell me what y'all think.
Do you have health care? I don't have health care. They're saying the health care prices are about to triple. For an $80,000 salary for a couple, right under $20,000 is going to be the new cost for a year. Divide that by 12. They're saying the prices are tripling and going up because just like me, you guys are also canceling healthcare. We've learned through the last 18 months, it's cheaper to just pay cash prices. And if you have healthcare, they don't allow you to pay cash prices. So for the small percentage of people who are still insured, the insurance companies have to raise the prices because at the end of the day, it's profit over people. Profit over people is what's important to them. Example again is $80,000 income and $20,000, right under $20,000 is for childcare. Who can afford that? I guess the beautiful thing is a lot more people are going to cancel their insurance and go the cash route because it doesn't mathematically make sense to continue to pay for healthcare in America. First chocolate of the day. I haven't even had food. Who cares? Wife, if you're watching this, it wasn't me. I didn't do it.
Health insurance companies in the U.S. are set to raise insurance premiums on Americans by the most in 15 years. Oh, and United Healthcare listed Trump's tariffs as to part of the large increases expected for Americans next year. Don't be surprised if your employer-based health insurance premium also goes up. Yes, that'll likely mean you'll see a smaller paycheck each pay period. Oh, and that doesn't even account for the millions of Americans that will lose their Medicaid. So much winning.
October is gonna be it because of your health insurance. Well, guess what? Health insurance are jumping 18%. Biggest spike in 15 years. Health insurance companies are raising premiums up by 18%. That's the steepest increase in more than 15 years. The official reason, they're blaming tariffs, which I don't understand what tariffs have to do with the health insurance. But let's be real here. Whatever excuse they use, is families who's going to get crushed. It's hitting at the same time inflation has already jacked up groceries, housing, and utilities. Wages aren't keeping up. So now people are forced to choose. Do you pay your health coverage or do you pay for survival today? And here's the dangerous part. When premiums jump like this, people start skipping coverage, delaying doctor's visits, or ignoring symptoms altogether. And that ripple effect is exactly what keeps us trapped in a collapsing healthcare system. This is bigger than another price hike. It's another way that control gets enforced. The cost of staying alive is being pushed out of reach. And this is one of the main reasons why I'm bouncing up out of here, because I'm going to make sure I have proper health care. This is like one of the number one reasons why I'm leaving. But you know what? I'm going to give you the full breakdown on who benefits and what moves you can make to protect yourself. I'm going to put all that on Patreon. But I'm going to say this, and I'm going to keep saying this. I do not care if you work with me. I do not care if you buy from me. But I do know this. The ones who listened, the ones who bought, the ones who are working with me, they're going to be better prepared than you. You need a plan B. Whether you get that from me or not. Like I said, I can care less. But you need a plan B. Tools in the bio if you're serious about protecting you and your family. Like I said, the full truth always lies on Patreon.
Hey y'all, happy Friday. Just so you know, Congress has until the 30th to keep the government open by raising the debt ceiling. And Democrats are saying they're gonna stick it out and not sign anything or not vote on anything until Republicans say, okay, we're not gonna take away subsidies for people that use the marketplace like myself, and my subsidies come to about $800 a month, and I pay $179 a month right now. So that would make my premiums almost $1,000 a month, and I don't even make that much. Sometimes, some months, it just depends. And as you know, I see a bunch of doctors all the time. And that's not even what my insurance doesn't cover. So, like, you know, labs, I have to pay 25%, imaging, things like that, you know, whatever. But, yeah, people like myself, and they're saying that even people with private insurance, like through their, you know, group plans, that the insurance companies are going to raise their premiums for them because, yeah, they're going to lose a bunch of people that pay for it on their own, like myself, so they're going to have to make up the cost somehow. So there's going to be a shit ton of people without insurance, health insurance. People like myself, people older than me, the boomers that are still around, you know, hospitals are going to close. I mean, this is all, don't buy the bullshit that Donald Trump is saying that our economy is doing great and inflation's better and groceries are down. It's not. Nothing is better. Nothing is fucking better. And the big bullshit bill is exactly that. So your vote matters. You need to vote every single election, county, city, state, federal. You need to look up on the propositions, the candidates, for whoever represents you, that sort of thing. It is so important, and these are rights that people fought and died for. My dad was a Vietnam vet, had 2 tours in Thailand during Vietnam, and he died from being exposed to Agent Orange because he worked on the jets that dropped Agent Orange. Yeah, it's getting serious. It's getting serious. And I hope the Democrats don't cave. I don't want to see people, you know, not getting paid and our soldiers not getting paid because they can't come to an agreement, but something needs to be done, and somebody needs to stand up to these fucking Republicans that are literally ripping our livelihoods away from us. Health insurance is a right, not a privilege, you know, and it shouldn't come to this. It should be a right for every single citizen. I'm so fucking frustrated right now. Like, I'm scared to death with all of my health issues, what I'm gonna do if I lose my insurance. Seriously, like, I'm terrified. I mean, I do counseling every 2 weeks, sometimes every week. I see a psychiatrist because I have depression and anxiety, and there's a lot of that. I mean, there's a whole lot of reasons why, but big part of that is my health issues, you know, because there's so much stress related to what I go through every day that I don't even share on here, you know. So yeah, y'all make sure you're registered to vote, and if you're not, get registered. And here in Texas, we've got propositions coming up in November 4th. The last day to register is October 6th. That's like a week and a half away, so get it done. Love you, bye.
So I wanted to address the Cigna thing. I'm off today, obviously, but I'm not really off because I'm never off. I need a chart. But just with the Cigna thing, from what I understand, they're going to start in October down coding every single one of our level 4 and level 5 claims. What does that mean? What's a level 4 or level 5? So basically, whenever we see a patient that's a bit more complicated, we bill a level 4 or 5. Less complicated is typically level 3. Level 2 is normally like nurse visits, blood pressure checks, things like that. Level 1 means we're not billing at all. So level 4, I work in cardiology. Almost every single one of my patients is a level 4. I am billing for multiple different things that I address. I address their heart failure, their coronary artery disease, their high blood pressure, their high cholesterol, their diabetes, their kidney disease. You know, the list goes on and on. So I am billing high, and I actually even got audited once for my billing, and I was found to be 100% within the correct billing. I billed nothing wrong, and I almost always bill a level 4, sometimes a 5. Cigna doesn't want to pay for that anymore. So Cigna doesn't care that you have heart failure, that you also have coronary artery disease, that you recently had a heart attack. Cigna doesn't care that you were recently in the hospital. They do not care that your doctor or your provider needs to bill higher for these because it's a complicated visit. They're not going to pay for it anymore. They're going to immediately down code us to level 3, and then unless we submit an appeal, which you've already seen the process that we go through submitting appeals, if we don't appeal that denial or that down code, there's a chance we're not going to get paid properly. You know, and the thing is that at the end of the day, I work for a private practice. If we don't get paid, we can't practice. You know, people think we make like a ton of money, but we really don't. You know, a lot of the money that our office makes goes to our staff. Goes to running our operations, you know, any kind of renovations that we need, keeping our labs open, keeping our equipment going so we can do, you know, low-level procedures in our office. So this is a big hit because what's going to happen is you're going to see companies and providers, small practices, stop taking Cigna, which is going to affect the patient. So, yeah, this sucks for Cigna patients, and I just don't know how it's legal, honestly, but here we are.